Hello. I, just to give a bit of an introduction, I am Lesley Smith. I'm a network officer with the Scottish Recovery Network, and we're really excited because I'm having a conversation with Lisa Archibald today as part of our peer chat series. So, Lisa, welcome.
Thank you, Lesley.
It's good to see you.
Yeah.
So, I met you quite a number of years ago in the Borders when you were the manager of New Horizons Borders. And I followed you from the years because you were quite inspiring. Well, not quite inspiring, you are inspiring. It's the first time I heard about a Churchill Fellowship, and following you, what you've been up to since then has been incredibly exciting. And so tell us a bit about yourself.
Yeah, so I've worked in peer support. I've been part of peer support for about 20 years, because originally I actually accessed peer support groups myself. So my starting point was when I was a graduate. Actually, I finished university, ironically, studying behavioural science, and with the intention to becoming a clinician at that point. Was really struggling with just having an existential crisis, probably. And so I started by accessing peer support groups and really falling in love with how that was as a way of being with people. And I tried a few other things, working in social work and doing a few other jobs, and just couldn't feel comfortable. So went to run peer support groups originally, and then I started to manage peer support groups. And that's obviously when I was at New Horizons. Prior to that, I'd been in advocacy for a while too. And then this Winston Churchill Fellowship opportunity that I got in 2013 took me over to New Zealand and Australia. I loved travel. I loved learning about other communities. I started to do a lot more. So I started to do more research, and also became a trainer. And kind of came back for a bit, packed my bags, applied for a visa, and went back to New Zealand, and ended up there for about almost 7 years. And then last year came back to Scotland mid-pandemic. So and I work now for Intentional Peer Support, an organisation it's international, but it's based in Vermont in USA. Obviously, Brilliant. I don't commute.
Well, with the power of digital these days.
Although one thing I would say is I really miss being part of grassroots communities that have that kind of mutual focus. It's the first time in 20 years that I've not been part of a community like that, and I do feel I'm missing it. Mm-hmm.
Yeah. So thinking about that, then, why is it important to you? What is it about peer support that's important to you?
I mean, I think looking back, when I first accessed peer support myself, I think what I noticed was that it felt like I'd found my tribe. When I was in all these other spaces, all the conversations were about what's not working in my life. And it was like being in this vortex of negativity. You know, if you were struggling or having a hard time, the conversations were about your problems or your symptoms or what wasn't working and how you were going to, fix it all. But actually, when I then was with other people who there was this kind of shared commonality, we just talked about life. And actually, it's the first time that I'd really talked about the struggles of the fact that my parents were teenagers when they had children, and I started to think about actually from their perspective, how it must have been hard to be 16, 17 and having kids. And I grew up in a mining community, and I started to process and talk about some of that stuff around the mining strikes and the impact that had on our family, and I hadn't talked about any of that stuff. And it started to make me think about how when I was struggling, I went to one place and they wanted to talk about giving me a diagnosis and medication. But then when I was in this other space, we didn't talk about that. We just talked about our lives and how all these experiences we'd had influenced the way we see the world. And so one space was telling me, you have obsessive compulsive disorder. The other place was going, wow, no wonder you see the world as unsafe. No wonder the world feels scary. And it's like, thank God somebody understands. And I didn't feel like I was broken. I just felt like I was understood. And I think that's what I get from peer spaces, whether I'm working there or, accessing it myself. And there's been times over the years where I've dipped back into it and I've had to go to a group myself, or access some supports, and I've always found it just a different way of processing life.
Yeah, I think I could agree with that as well. There's something about that sort of, you can let somehow you feel you can just let some of the barriers go, or the boundaries go, that you would see maybe in a different type of relationship, and you go, oh, well, I've got to fit in there, but in a peer relationship, I can just let some of these things I'd be a bit more wary about out, and it feels a bit like, they get it.
Yeah. And there's no presumption that you need to do anything different. Like, I would find I'd go to talk to clinical services or counsellors, and there was always this assumption that I had to change something. I had to do something different, whether that was, do these things and you'll be well, or whatever that was. Whereas actually in these other spaces, it was like, yeah, sucks, or yeah, it's hard, like full stop. No presumption that I had to do anything different. I could just be accepted as being, a little bit manic or a little bit crazy, and actually just being okay to be like that.
Yeah, I think that was one of the biggest lessons I would say that I've learned about myself as well, and it's through a lot of peer relationships that I didn't have to fix myself, but I could accept myself for who I am, and then beginning to see myself in a bit differently. It did have a profound impact on me. So it's really interesting that you're saying something quite similar as well. I was thinking about, what are these bits that make peer support, and how important it is that we recognise what that is and we can articulate that. But also, we're talking about also as well about, as we create opportunities for peer support to happen, as we're saying, as we bring lived experience more to the forefront, encouraging people to learn from and engage with what people have learned from their own experience, and we're seeing peer roles being developed. So one of the things we really want to be mindful of and work hard at is keeping that integrity of what that peer relationship is. So I wanted maybe to talk a little bit about with you around what are some of the things that you've learned or you've done about preserving that uniqueness that is peer support. How do we keep it?
I mean, I think I'm going to try not to be too controversial around this. I appreciate the fact that I don't sit within services or systems. I'm just an independent person, so I can often be a little bit more blunt than maybe if I worked for somebody where I had to watch what I say. I think maybe my passion for being part of grassroots organic communities comes from the fact that it's independent, and so what's measured in terms of success is actually relational. It's like, actually, if we're having positive relationships between ourselves and we're part of a community, it's that kind of collective stuff. And I worry a little bit, and having been in the peer support world for, a couple of decades now, I worry that we're moving a bit more towards the individualistic way of being with peer support. And in terms of kind of how do we keep the fidelity, is like, well, how do we make sure we're still being relational? And I worry a bit that more and more, and I do a lot of training of and also co-reflection and supervision, all sorts of things with peer workers, and how often people are coming talking about a client or a goal plan, or about frustrated because people won't change, or they're so stuck. And it's interesting because it's this idea that maybe it's a spoonful of peer support, like another intervention. And I think we need to be wary of how integrated we become, and still remembering that this was created from a time and place about doing something different outside the norm. Like, this was about a bunch of activists going, we're not just a medical model. We're not wanting to be pathologized. We're people, and we're humans, and we have experiences, and we want to connect with other people who have similar experiences. And it was never necessarily about systems and services. It was about conversations and relationships, and also about activism and human rights. And I think sometimes we move and we veer more towards becoming services rather than actually remembering we're part of social movements. And part of being a social movement is actually, we want change, we want something to be different. And sometimes I think we're maybe losing that flavour a wee bit.
So tell us a wee bit more about what do you mean by social movement for peer support?
Well, I think about, like, so back when in the 60s and 70s, it was a really kind of dominant asylum-based institution model, you know, and actually, you know, the people that were most oppressed were actually the people who are marginalized by society anyway, you know, people of color, people who are, you know, queer people, gay people, people who are poor, working class. And you think about, these are people who are already oppressed within society. And it was another way of kind of reinforcing these social norms.
Yeah.
And, you know, psychiatry has only existed for a couple of 100 years. It's just one perspective. There's so many other, and I think sometimes we're privileging this as a dominant truth. It's like, it's become so unquestioned that it's become like this global truth, instead of going, well, where's the spiritual explanation, the cultural explanation, the nutritional explanation, whatever that is. And I see less and less there being space for us to just have these conversations around what's your explanation of your experience. You know, what we don't talk about what causes distress. We're so busy trying to fix it or shut it down, instead of going, what's making people go mad in the first place? Because actually, I think that sits with social justice, and that's where we need to kind of intertwine social justice with peer support.
Wow, thanks. I think that's quite a lot for us to think about, isn't it? But yeah, and I think when I think back of what first attracted me to peer support, because at the beginning I was thinking, this is really good. But if we're going to create formal roles, we need to be really careful that it doesn't become something that loses that sense of what it is and where we've come from. And it was one of the things I was really quite intentional about when, you know, a number of years ago, when Scottish Recovery Network, as part of our work, we worked with people to develop a values framework, because that was part of our focus, was because people were concerned about how do we ensure that we don't lose that relational aspect, that it doesn't, as you talked about, the focus becomes on goals and outcomes, but it's like what is it that happens in space between us. And this was something we would have found really helpful. But you mentioned again about relational. Where's the power in the relationships and peer support?
I mean, for me, it's just, I mean, peer support is relational. It's a relational way of being. And I worry that, again, that we're moving towards it becoming a job or a job title rather than actually, and I ask people all the time, well, what are you doing differently? You know, how are you working in a way that is about relationships? So we're not veering towards the whole fixing, helping stuff, but we're actually thinking about how can we both learn and grow, because we're having meaningful conversations. So because we're both having this exchange, we'll be co-creating this shared wisdom. So we'll have a conversation, we'll go, I never thought about it that way. And I think what's been so helpful for me around working relationally is that it's actually reduced a lot of the conflicts that I have, and also some of the frustrations I used to get in peer support when I would see people stuck and not changing. And I'd think, you know, but we just had this conversation. I told you all the things you need to do in your life and you're still stuck and things aren't changing.
Yeah.
And I started to come more from a place of curiosity and start to think about, okay, this is how I see things through my lens. Tell me how you see it. You know, like actually trying to be curious about the other person's perspective. If we don't agree on something, it's actually trying to understand, well, what's happened in your life, in your upbringing, in your experiences that makes you see things so different than me? And then we can start to open up conversations instead of disconnecting and getting frustrated. So, you know, one of the things I was proud of that we did way back when I was in New Horizons as a peer community was like when the welfare reform bill came in, is that actually we started to think collectively as a community about the impact this was having on people here in the borders in particular, but also people who were already struggling on benefits, and starting to think about we're in relationships here. This is a community. We are a community. And even though I'm privileged because I was paid, this other person that comes to the same community as me that's on a benefit for whatever reason is going to be really hammered by this. So we started to think about campaigning, about advocacy, about systemic change. So it wasn't just, let's sit around and talk about how crap it is and it's making us ill, but actually what we're going to do about it. And that to me is so important, that if we see ourselves as being in relationships and part of collective communities, we start to think as a whole. And we're not just thinking individually like, oh, well, this will affect just you, go and get this help from Citizens Advice, but actually, what can we do together?
I think that's a really important point as well, is that thing of what can we do to get together. It's not just about I'm here to help you, or the power dynamic in a way is a bit different. I'm here to do something for you, but together we can think about what is it be helpful for the. Well, it depends on where the peer group is, a group or is it a couple of people meeting together, what's going to work for us both. I think that it's thinking about how do we create more opportunities for that to happen in Scotland today, but also thinking about, we are aware and we are encouraging, well, certainly within Scottish Recovery, a network about roles that are about people who are volunteering, about taking on facilitated peer groups, paid peer roles. In your experience, you've talked a little bit about training there, maybe around the relational aspects of people and peer support, but I'm thinking also about, or I wanted to check out with you, in your experience, what are some of the things that have helped you when you've worked with organisations and people who are creating these more formal roles? What's really helped them do it? Not the stuff that gets in the way, the stuff that helps.
Yeah, and I think it becomes a recurring conversation for me. And I do a lot of work in the US now, and it can be a little frustrating that how they set things up, and it's funded in a very different way and measured in a different way. And my starting conversation is always, why a peer? You say you want a team of peer workers, you want to set up something within your state or system or service. Why? What is it you want that's different about this that you've not always already got? If it's just about whacking the word peer in it, don't bother. If you actually want to do something different, if you want a group of people that are going to connect with your community in a different way, then bring it on. But actually then, how are you going to change your policies? How are you going to change your procedures? How are you going to change all the stuff so that the clinical team are also learning from the peer team and vice versa? So it actually becomes like, what have we got to offer? And how can we understand each other's way of being, especially if it's a mixed team. So what works well is having those conversations from the start around how, actually what we're talking about today, like how is peer support different? How is it unique? Why do you want it in the first place?
Yeah, and what's it going to add? What's it is going to be different from what's already there? I know we've had quite a few conversations quite recently, and I was really struck by the way that you've spoken about how peers can be supportive of each other and be supported in the roles that they take on. Can you tell us a little bit more about what some of the ideas are that you have there?
In terms of kind of like co-reflective type spaces? Yeah, and I think sometimes we make this assumption that we're all like vulnerable and fragile because we've got all these experiences that we've had. And I think there's a Frida Kahlo quote that I always remember, which is fragile, not fragile like a flower, but fragile like a bomb. And I like that because it's like, okay, well, maybe we are a bit fragile in terms of, I think about, and actually the reclamation of the word mad is actually what we've got to be mad about, because there's some things I feel really mad about, like the injustice and the inequality and the unfairness. And I think there's a lot we can learn from each other in terms of spaces where we can just connect and talk about this, because oftentimes I'll see services that set up and it's a supervision model, and actually all the spaces are around an agenda. So you come with an agenda and you've got to talk about clients, and actually at what point do we just talk about ourselves? And actually, when do we talk about our own stuff. Like, I know I make mistakes all the time in every relationship I'm in. All of us do. Like, I don't think any of us could say, I have a perfect relationship, full stop, and I never make mistakes. So when do we talk about that in our workplace? Actually, I'm going to make mistakes. How do I talk about it? How do we talk to each other about when we see ourselves and each other making mistakes?
Yeah.
And there needs to be spaces like that where we can just go, oh, hang on a minute. I made a mistake there. Can we try that again? And actually, could you give me feedback? Would you be open to feedback? And how do we have those kind of spaces? Because I think work, it feels so structured that it's formal and there's all these kind of expectations that we have to get it right all the time.
Yeah.
And the beauty of being relational is actually you can say, okay, we're going to mess up, but we can own it and we can work through it and we can try something different.
Yeah, I would totally agree. But that was a really powerful way that you described that there. And it's one of the things that I do and my colleagues do in our roles. If we're talking to groups and organisations around how they're either developing roles or supporting peer workers or with peer workers themselves and saying, well, what do you need? It's rethinking that supervision to a reflective space. How can we reflect on what it is we're doing? How can we use our values as a way to have that discussion, to frame things rather than have I got it right and have I got it wrong, or has somebody achieved something or have it not, and to go back to these values or back to, well, are we in relationship in a way that is what we define as fear, as peer.
Actually, you're right. Like, actually, sometimes it is quite fear-based. But yeah. Peer-based, not fear-based. We'll go with that.
Because sometimes you are stepping outside of your comfort zone, because I found it very easy to be in a particular way. It takes a really intentional way of trying to pull myself back at times and think about what is it that I'm saying, how am I being, rather than just go, hey ho, let's get in there, let's get this fixed.
And I think being able to talk about like where some of that stuff comes from has been helpful. Like, I've been able to have really honest conversations with colleagues around, like, when I feel like I'm not getting it right, I start to get this fear of failure stuff, and I know how that comes out, and I'm going to start to try and control things. And it's like, can you let me know when I do that, so we can actually talk about what I could do differently? Because that's how I learn. And if we're open to doing that, rather than this presumption that because I'm the manager or the CEO or something, I'm going to get it right all the time.
That's really powerful. So I'm also now aware of the time. I would love to have to carry on this conversation, because I think it's really, we can really dig deep into some really gold nuggets in there. So is there anything else, as we bring this to a close, is there anything else you would just like to add for our people who are listening to our conversation? You've got any last message?
I suppose my last message is thinking about, I mean, I really do, I'm an activist probably at heart, and I think about what can we learn from other social movements in terms of how they achieve change. You know, I look at, you know, the LGBTQ queer movement, I look at, you know, the feminist movement and, you know, civil rights, and it's like some significant and radical changes happened when people have thought like activists.
Yeah.
And I think at times, if we want to see the system being differently, sometimes we need to challenge it too and start to go, what's possible, what could be different, and how do we work in a relational way regardless of what our roles is, and push for something that feels, I'd like more radical change, I'd smash the whole thing, but you know, I'll start more manageable than that, and just say, you know, think change. Mm-hmm.
Brilliant, thank you. And I think that's a good way to end for just now, and a bit of a challenge to the rest of us. Think about change and think about what we can do. So thank you so much. And
thank you for listening to my rants, people. I much appreciate it.
I wouldn't have called them rants. I think they're really insightful comments and thinking, and show the depth of how you've come to think and experience things the way that you do, and we're really grateful for you to share that with us. So thanks, Lisa.
Thank you.